Welcome to Cyprus Facial Surgery. Hello, my name is Neophytos Dimitriadis and I'm an oral and maxillofacial surgeon and facial cosmetic surgeon. This video is about rhinoplasty. Cosmetic nose surgery, otherwise rhinoplasty, is a procedure that improves the appearance and proportion of your face. Nose is a major structure of the face with the prominent features that can improve significantly with these cosmetic procedures. With cosmetic rhinoplasty, we enhance facial harmony and self-confidence. Nasal surgery may correct breathing problems and defects that come along with birth or other syndromes like cleft lip and cleft palate, or can be used to correct traumatic injuries to the nasal skeleton. How is this procedure performed? To reshape the nasal skeleton, can use three types of procedures. We can use a closed rhinoplasty, which is a procedure that the incisions are performed inside the nose. You have no access to the front part of the nose, the nasal tip, but you can reshape the middle and superior part of the nose. This procedure is good for patients with nasal hump and middle and superior vault discrepancies. If somebody wants to change the tip, the anterior part of the nose, then a procedure known as an open rhinoplasty can be performed. With this procedure, we have a small cut on the inferior anterior part of the nose, named as columella, where we can achieve access to the whole nasal skeleton and can correct discrepancies of the anterior, middle, and superior part of the nose. This procedure is good for patients with discrepancies of the anterior part, nasal tip, middle, superior part of the nose. There is some combinations between closed and open procedures, delivery approaches that every surgeon can combine to get better results for their patients. Welcome to Cyprus Facial Surgery. We have this patient today, that's the second case. We're going to move on with a rhinoplasty. You can see here we have this nose, and I'm going to analyze this nose for you. What we have a bossy tip with no defining points. You see this trapezoidal shape of the tip. We're going to take it from below and we'll check. We have this small hump on this area, and of course we have these irregularities of the middle part of the nose. So the upper part of the nose is very okay, so we're not going to touch the radix. Sometimes if you have this angle here, the frontonasal angle, and it's very obtuse, you may need to increase a little bit the frontonasal angle by putting a radix graft. In that particular patient, I'm going to take out the hump. All right, as you can see, I mark here. I'm going to put intradermal sutures to define the area of the tips. I'm going to do a septal axial spreader grafts to increase the lateral wall and septum angle in order to give a better breathing and non-obstructive breathing. And of course, I'm going to correct this deformity of the nasal tip. If you take the nose from below, if you come over here and take the nose from below, all right, you see that the tip is trapezoidal. Normally this tip should look very triangular, and you can see that these points here are very apart, which means that we don't have this very nice shape of a triangle. I'll take a pictures immediately after we finish the rhinoplasty, and I'll show you what else we have. Furthermore, the nasolabial angle, it's on a good actually 90 degrees, so we don't want to touch it, so we're not going to need to reduce any further the anterior nasal spine because the projection of the nose and the lip are on a good actually proportions. So in this particular patient, if I summarize, I'm going to just define the tip, define the dorsum, and of course put spreader grafts and close down the deformity of the open deformity after the dehumping of the nose. That's a European nose, normally what we do, and that's what you get in the European nose. You don't have a huge hump as you see on the Middle East noses and needs significant reduction. Thank you very much and welcome to Cyprus Facial Surgery. I will come back with the final results. Furthermore, I forgot to say that this approach will be done under an open approach with a small chevron incision down in the midline, which will dictate, all right, the opening of the nose. Thank you very much and we'll come back with the final results. Welcome back to Cyprus Facial Surgery. You can see here we just finished up with the rhinoplasty. You can see the very nice actually alignment of the dorsum. The dorsum is being reduced. The area of the radix to the dorsum is straight up. The tip, if you see it from underneath, is very triangular and is very actually reduced as a composite tip. It became a very triangular one shape. Tip defining points are very nice and very well defined. You can see a very nice transition like a gull wing from the eyebrow down to the area of the tip projection points. And of course, if you see from below, okay, you can understand the very nice shape and the very nice symmetry of the two nostrils are pretty much symmetric. That's what we do, and you can see here the very nice triangle that we created on this nose. That's what we do here in Cyprus Facial Surgery. That's a very nice rhinoplasty with a lot of actually details on, and we finish up in about 2 hours. The patient will take back to her room. There is no bleeding, there is no gas inside the nose, there is nothing. Of course, you're going to have some swelling coming up by tomorrow, but that's all. Thank you very much and welcome to Cyprus Facial Surgery.
Nose surgery can reduce or enlarge nasal structures by the use of grafts in order to change the shape and the function of the nose. Typically, pieces of cartilages from the septum can be used to correct the shape of the nose and sometimes to correct the area of the nasal valves. Many times, the shape of the nose can affect significantly the breathing. Breathing is related to the angulation of the nose and the nasal septum. If the nose is very narrow or if the septum is deviated, many patients may suffer from significant nasal obstruction. With nasal surgery can correct, in addition to the aesthetic proportion of the face, the breathing problems by correcting the nasal angulation to the septum or straightening the septum itself. Most of the times this procedure is performed either by an aesthetic cosmetic surgeon in combination with an otolaryngologist who will treat many other problems associated with breathing like hypertrophic turbinates and deviated septum. What are the different types of cosmetic nose surgery? We have primary rhinoplasty and secondary rhinoplasty. Many times we need to revise a previous surgery because the patient is not happy with the results or the breathing is not 100% corrected. This type of surgeries are known as a revision rhinoplasties, and of course it's a surgeries that they need more experience, and of course the outcome and the complications are higher. Many surgeons, they may use some fillers like hyaluronic acid or permanent fillers like silicone to correct small discrepancies of the nasal skeleton in order to provide better harmony of the nasal frame. This is a very well known and acceptable procedures that can be performed nowadays without surgery. For instance, instead of removing a nasal hump, you can fill posterior and anterior to the nasal hump the area with the use of injectables and straighten up and smoothen up the roof of the nose. What results can somebody expect from a nasal surgery? Cosmetic rhinoplasty, nose surgery, can dramatically improve your appearance. It is very common to feel dissatisfied immediately after the surgery because of the swelling that you're going to have after the surgery. During this recovery time, you may see gradual changes of your nose that the outcome will be more obvious 6 to 10 weeks after the surgery. The final results of the rhinoplasty may be appeared approximately 3 to 6 months after the surgery. What is involved in recovery? Cosmetic rhinoplasty is performed as an outpatient procedure in our hospital. Most of the patients receive IV sedation, some of them general anesthesia, and they return home the same day. The patient returns home with a splint on the nose, a small white patch on the front of the nose that is removed 10 days after the surgery. After the surgery and removal of the splint, the patient is swollen for a couple of days, but he can return or she can return back to work
in a period of 10 days. This external splint may be used to protect the nose and support the nose during the recovery period. Most of our patients resume light activities few days after the surgery. However, it will take few weeks after the nose is completely healed to allow for full physical activities. Welcome to CyprusFacialSurgery, where we have a patient here immediately after rhinoplasty, a day after rhinoplasty. How do you feel?
I feel fine.
You had any pain?
No, I can't feel a thing.
Alright, so you can see that immediately after we have the splint on, there is no bruising on the eyes, not even a bruising on the eyes. We shape the nose, of course the nose will be actually exposed in a week, but you're ready to go home now, right?
Yeah.
And you're very happy, right?
Yeah, I'm happy. I could sleep, I could actually eat, like right after my surgery, I could eat and chew like normally. Yeah, I'm fine.
It's perfect, and no pain at all.
No, nothing.
And we put nothing inside the nose, nothing at all. Thank you very much. Welcome to CyprusFacialSurgery. So welcome to CyprusFacialSurgery. We have a patient 10 days after rhinoplasty, and you can see the perfect results. If you turn your nose towards me, it's just 10 days after rhinoplasty. If you can zoom on the nose, you can see the very nice transition of the eyebrow down to the area of the tip. You can see the very nice shape of the nose, no black and blue eyes. If we turn up, you can see the very nice triangular shape, symmetric nostrils, very nice tip definition points, and of course, in the 45 degrees, you can see the hub reduction and the very nice tip projection. So this is what we do here in CyprusFacialSurgery, just a week after surgery. How do you feel a week after surgery?
I feel amazing about my new nose.
Feel
Way
amazing.
more confident than before.
Perfect. Thank you very much and welcome to CyprusFacialSurgery. Welcome to CyprusFacialSurgery. Here we have a patient about a month after rhinoplasty. You can see how this nose is being done. You can see the very nice projection of the nose, very nice tip definition, very nice actually nasal radix with no hump. Hump has been reduced, very symmetric the nostrils, very nice the tip, triangular shape, no scars, and of course the patient is back to her normal activity, to her gym and everything. Thank you very much and welcome to CyprusFacialSurgery. Here what we do here in CyprusFacialSurgery. Thank you very much. Is cosmetic nose surgery a safe procedure? All surgical procedures have some risk. The possibility of complication is low in every cosmetic surgery. As surgeons, we always weigh the risk and benefits, and only when the benefits outweigh the risk, that's the only time we perform cosmetic surgery. Though, some of the possible complications that are associated with this procedure are the following: swelling, bruising, difficulty breathing, difficulty smelling, and deformity of the nose. However, most of the times our patients are very satisfied, and these procedures can add to their confidence and socialization by fixing the harmony and the aesthetics of the face. Even a minor correction of your nose can make a significant difference in overall harmony of your face. Most of my patients, they report little or no pain after the surgery. Rhinoplasty in the current cosmetic surgery of the face is one of the most common procedures that can be performed with a little complications and provide significant benefit to our patients. For more information about rhinoplasty, please visit our website at www.cyprusfacialsurgery.com.